Right, guys. We are back, and this time we are with Dr. Ellenore. Dr. Ellenore is a doctor, and she's going to be talking to us about where we are currently with, just what she's been busy with, what she's been up to, where she comes from, her sort of experience, and maybe give us a couple of tips in terms of what's going on the ground. So, how are you doing, Doc?
I'm doing well. Thank you so much for having me. I was just saying to you, I was concerned myself. I've been symptomatic. I actually did have a contact. So I did my COVID test and it came back negative. So I'm very grateful to say I did not get it. Although for the majority, we shouldn't be too concerned if we do contract the disease. But still, I need to continue working.
Yes, I actually heard in the news this morning, we had a couple of news blasts across the platform, and I heard that there were a number of doctors that actually have tested positive. You know, we take for granted the fact that we've got all these amazing people that are putting themselves on the front lines and exposing themselves to the virus for the sake of people. So it's really noble, and hats off to all of you.
Thank you so much.
Fantastic. Okay, Doc. So tell us a little bit about yourself. Give us a little bit of your background.
Okay, so I studied medicine at Tikkies. So I actually did a master's in ethics and health law, and then I did a PhD in holistic health or spiritual care. But the majority of my day-to-day work goes towards holistic health, which includes essential primary care, looking at nutrition, and offering care in informal settlements for the most vulnerable communities in South Africa, in and around Pretoria. Okay,
and so when we talk about, listen, I just wanted to ask you something. I heard a video clip this morning, an audio clip, and this guy was talking about the fact that one of the biggest disruptors to our immune systems is actually stress. So that what he was saying was the amount of news and the amount of fear that's been generated from this thing is actually detrimental to our health. I mean, do you want to speak on that?
Absolutely. No, I mean, so that's part of the research that I've been doing, and I think that's something we really have to be concerned about, that if we don't take care of ourselves from a spiritual and emotional point of view, we end up damaging our own health and it catches up with us. So in times like these, where you are in an environment that is more emotionally tapping, you have to harness the resources that you have to make the best of this time to stay calm and enjoy good mental health.
Sure. And tell us, Doc, I mean, like, what's it like on the ground for you at the moment? I mean, what are you seeing out there?
So our first clinic started today. The last 2 weeks, I spent a lot of my day training for the University of Pretoria. We have community health worker teams. And we had to address a lot of concerns from health professionals, carers that are putting themselves on the front line and getting the referral pathway in place. But I must say there's been an overwhelmingly positive response from so many people, friends, people, I don't know, NGOs, partners coming on board, asking what can we do and how can we make this easier for us to collaborate.
Fantastic. And are you finding that you're getting a lot of support from the private sector? I see the private sector seems to be trying to throw their weight behind this thing.
Yes, so for the first time, sorry, I just have to plug in my phone. For the first time, I'm really excited to see how the private sector also wants to partner with the public sector. And just before I came on live, typed a proposal to one of the private sector big companies said, listen, we want to partner with you, possibly even open a testing site here for private and public in Pretoria, specifically then in the east, where informal settlement people can come, be tested, but also then people be tested from the private sector. Sorry, that's my husband.
How are you doing? I mean, listen, that's really encouraging. You know, I had a conversation earlier on with a company called Ranyaka. I don't know if you're familiar with them, but they focus on social development and social planning, and they work quite closely with communities and NGOs. And they've also found that they're getting decent support from one of the bigger banking companies. And it's amazing how something like this has just brought everybody together. And I think that's the common thread, the theme that we're getting out of this whole thing. I mean, what is your view there?
Yes, absolutely. I think all of us are going to think differently, not just about how we work, but how we collaborate. And you now work with people that in the past you wouldn't work with, or it's a multi-industry collaboration to find solutions. And hopefully that's one of the things that will stay with us after COVID, that we have learned to work together across industries and broken down some silos. Hopefully that's one of the things that...
Sorry, are you there?
Yes, I'm there.
Sorry, Doc. I just wanted to pull up. We're getting a couple of questions from our people, and I just wanted to pull it up without. Okay, all right.
Sure.
There we go. All right. So if you guys are watching this, sorry, just give me a second. If our members are out there watching this and you have any questions for Dr. Ellenore, please feel free just to drop them in, and we'll respond as we can. Sorry, Doc. I beg, just excuse me 1 second here. Just bear with me, all right?
No problem.
Okay, fantastic. Okay, so just to get back on track. So, what would you say has been the response from to this from government? I mean, you're getting a lot of government support, or are you finding that they're working quite closely with you on this?
Yes, absolutely. We see daily protocols being updated, which I'm really grateful for. I think from a medical perspective, we want to have an evidence-based medicine approach, and we can see that people are actually doing that. That clinicians are coming together with government. The fact that our government stepped in early on, and I read today again, they offered social support, nutritional support. There's numbers available that I can share with you afterwards that you can post, where let's say there's someone going hungry in your area, you can phone the local Tshwane region and ask that they help you and support you with food. And I believe that would be all over the country for regions. And we've seen people come together. So we do, from the Department of Family Medicine side, street medicine, where we work with the homeless. We do drug exchange programs. We support sex workers. And we've seen people volunteer coming out with us, asking us to help. Do we have enough resources yet? No. But are we working on solutions? Yes.
That's fantastic. Are you getting any sort of assistance from the international community? Have you found them to be helpful at all?
So Rotary was one of the people that did contact us, and I know some of the people, Rotary has sponsored some of our projects in the past in informal settlements, and they indicated that they would be willing to help. Practically, where I've been working, not so much, although indirectly through some of our NGO partners. SA Cares for Life is a partner specifically with regards to COVID. Lift Community Church, NPO from Moreleta Park, has partnered with us. And we had a major drive to get food for 10,000 people in quarantine. I think we have about a third of the food for people we're going to have to quarantine in the next month or 3. And Emma Brave to Love, another NPO, came on board. So we saw smaller and larger NPOs, some with a local footprint, some with an international footprint, supporting the drive to have people stay at home, be safe, and be able to eat.
That's really amazing to hear. What is the other? Okay, so tell us about holistic medicine. I mean, just give us a little bit of insight into what that is for the layman, like myself.
Okay, so it depends where you're at and what your current level of living is. But let's say you do live in an informal settlement site. Whether you're rich or poor, all of us have certain basic needs. And so holistic health is a development model, but it's also a personal self-actualization model, where we say once your primary needs have been addressed, you're sleeping warm, you have enough food, we've addressed your blood pressure, you might want to achieve more. You might want to say, listen, I want to run the Comrades, or I have a mental health issue and I want to address this. And so holistic health looks at your sleep, hydration, nutrition, your mental and spiritual current state, your environment state, and it tries to address in a systematic fashion those needs. And so what we do from a community perspective is often I work with people that are struggling with level 1 to 3 issues, which is I'm not safe, I'm still hungry, I can't access my medicine. And once we've addressed those needs by the local clinics we establish in informal settlements, by putting down a container, bringing in a team, we start counseling people. We start addressing, should I have another child? How should I think about sex? Why did God allow me to live in conditions like these? Issues that people grapple with.
Yeah, that's amazing. Would you? I mean, what would your advice be to the South African community at this stage? Both those that have got COVID and those that are tested it or don't appear to have COVID at this stage.
So I think the first thing I would love to say to people is, you know what, stay calm and stay home. One of the government videos that I saw that I really enjoyed was stay home now so that you can travel later. And I think we're going to see that more and more, where people want to travel and we're not allowed to go out. And as we're building up this 21 days, and who knows, it might be longer, we really have to work on our mental framework and make it fun. Dress up. I saw someone having a dinner party at home last night for their family, and that was some of the things on my list. I did pottery with my family today. I think we should really work on making this time count, building good quality time with the people we are with. And if you have a small business and you're concerned about that, you know, instead of worrying for 4 hours, do an hour's online research and then take out a good book, put on music, dance in your garden. Make sure that you relax, de-stress, and don't worry too much about something you can't do anything about.
I think that's a great message, you know, and that's the reality. You know, there's so many things in our lives that are beyond our control, and we have to find some level of acceptance for that. You know, that we can't control everything. Would you say that there are definite changes that you think? Definite changes that you think the medical industry is undergoing at the moment that are going to continue into the future once this is all done? I mean, are you seeing a lot of changes of the way that we think about things differently? Have you seen any adjustments there? Do you think there's any major dynamics that are going to shift after this?
Absolutely. I mean, already we see the HPCSA, international bodies, local bodies like the South African Medical Association all started to speak about telemedicine and connecting with your patients, non-contact, but still clinical. And that's something people weren't open to in South Africa. We had some companies running that from here abroad. And for instance, I know in Florida, telemedicine is quite a popular thing. So we had doctors working in South Africa doing telemedicine for countries overseas. But this is going to become more the norm, I think, in our context. And it's a welcome shift because it's more affordable. You reach more people. You can address broader issues over a plane, where now you have to wait for someone to find time in your diary to come and see you. And then I do think people that are into health technology, applications, self-management, self-care of patients will receive renewed attention in the next era.
Fantastic, Doc. Listen, thank you so much for spending time with us. I've really enjoyed talking to you, and I'm sure our members have really taken a lot away from it. We wish you nothing but health and safety, and thank you so much again for your service to the country. And keep safe, stay safe, and look after yourself.
Thank you, Sam, to you and to all the listeners of #I'mStaying. Now is really the time to stay and also stay at home.
Fantastic. Take care, Doc. Thank you so much.
You too. Bye.